So the green wedge looks at referral, follow-up, case management, and delegated functions. So referral and follow-up. So if you're looking at the individual level, people who are diagnosed with diabetes. So, and those of you can attest who work in this area or have personal experience in this area, when you're newly diagnosed, whether it be type 1 or type 2 diabetes, there's going to be lots of referral, right? You're going to go and see a dentist, the eye doctor, maybe the foot doctor. You're going to talk to a dietitian. You might talk to the nurse coordinator, to an endocrinologist, and then following up. So, having some sort of reminder to follow up on these patients, this community. So, if you see that there's a school that has a high rate of type 2 diabetes in adolescents, we're going to keep following up, right? You're not just going to refer them and maybe implement a few projects and then leave and never check up again. You want to see how it's going and see where the needs are. Case management, so this could be done at all levels, and that's, again, an intervention where you're managing all the aspects of the healthcare, perhaps some social issues, to maintain smooth continuity of care. And then looking at the delegated functions, we talked about that. So maybe you have a community where transportation's hard. Maybe you live rurally and people need to get to the eye doctor. So delegating community health workers to set up vans, or to delegate functions. Maybe some nutrition counseling is done at a church because that's where most people are social. So implementing delegating functions at all levels is also really important. So the blue wedge is health teaching, counseling, and consultation, again, done at all three levels. So obviously we're going to do health teaching. And the difference between health teaching and counseling is health teaching is just giving, plain education, whereas counseling is assessing where the needs are, maybe areas people need to troubleshoot better. And then consultation, who do you need to talk to for more ideas? Maybe you have a deaf community and you need ideas on how to address health issues. Maybe you have a large Nepali population. I know I do. And the way I do health teaching and counseling is going to look different than with perhaps the Hispanic population because of the way health is talked about in that culture. So I'm not a Nepali expert. I need to consult those who are, perhaps second generation Nepalis who work in healthcare, perhaps community volunteers who understand the culture. So that's where consultation comes into play. The orange wedge discusses collaboration, coalition building, and community organizing. So again, collaboration is not just consulting where you're asking advice. It's you're working with another group to get to a shared goal. So you might collaborate with other health providers or health disciplines. You might collaborate with schools. That's a really popular form of collaboration in public health. So, and then coalition building and community organizing. So coalition building like a task force. Perhaps your city is very concerned with the opioid addiction. We need to form a coalition to study it, to come up with ideas and to implement those ideas. And then community organizing. So organizing all the different resources within a community to offer health services or any type of service to improve the outcomes. And lastly is the yellow wedge, so advocacy, social marketing, policy development, and enforcement. So advocacy is not just you at the individual level as a nurse advocating, but finding other advocates or advocating at all three levels. So if you work in an environment like Flint, Michigan, let's talk about what happened in Flint. There's this huge problem because the lead levels in the water are so bad. There's so many sick people, specifically children. And there was no one really advocating for a while, or the advocates were being silenced. And finally, enough traction was made, and now there's more and more advocates, and it has to be done at all levels and all levels of influence as well. And then the social marketing got big, so making sure you can reach the community, the individual, and the population to say, come in and get your kids screened for lead. come in and we have special treatments for you. We have lawyers who are going to help get your healthcare paid for. And then changing the policy, right? We got to fix this water so that kids don't get sick in the future. And then enforcement of that policy. So this is a really important wedge. And this is also when you're kind of thinking outside the box of direct health care, right? You didn't think that as nurses you were going to be advocates and social marketers and policy reformers, but you are. And nurses are, I think, best trained for that because a lot of other disciplines don't go through all of this. I think more and more disciplines implement this type of education in their curriculum, but in nursing it has always been part of the basis of it, on learning how to make change in policy and advocacy. Whereas, per se, a physical therapist, this wasn't necessarily part of their education. I think they're trying to do that more with MDs. It's definitely not, because they really have to get through a lot of medical school, and this aspect isn't part of it. So a lot of times med students get simultaneously a master's in public health. So again, nurses are really well trained in this area at all levels of degrees. So quick recall, which of the 17 interventions is often preceded by outreach activities and frequently follows surveillance? So there's community organizing, case management, counseling, and screening. Screening, okay? It frequently follows either surveillance or disease and health event investigation, and it's often preceded by outreach activities. And why is that? Because you're looking at surveillance of diseases or disease and health events, and you realize that there's a problem, right? So with surveillance, we collect information on syphilis, or we see a lot of congenital syphilis, so we investigate and see that there's high rates of actual primary and secondary and tertiary syphilis in a community. So now we got to screen people so this doesn't keep happening. And then it's preceded by outreach. So what are some outreach activities we can do for syphilis? We need to go to the schools. We need to go to homeless shelters and talk to people about coming in and getting screening. Perhaps we're seeing high incidence of high blood pressure through just reporting, or there's a lot of, kids at a school where the school nurse is saying, hey, I have a 22% population of adolescents with high blood pressure. Okay. Well, now we got to screen all the kids in this community, and now we have to do some outreach. Is it a sodium issue? Is it a family history issue? Are kids not getting outside to play because they don't feel safe in their neighborhood? Do we have parks? I mean, if you don't have parks in your neighborhood, I know for me, when I was younger, my parents always lived near a park so we could ride our bike there and go play outside. But if you live in an area where there's no place to play outside, well, of course your kids aren't going to run around, and of course they're going to be sedentary and have high blood pressure. So assumption 9, public health nurse practice contributes to achievement of the 10 essential services. So 10 essential services, what public health nurse does, which is protect and promote health. And the interventions are how it gets done, the means and the implementation. So assumption 10, we are grounded in a set of values and beliefs, and this is our cornerstone of public health nursing. So we synthesize values and beliefs from both public health and nursing. So we look at our intervention wheel, so what and how, and then our cornerstones as to why. We have values and beliefs as public health, in public health, that, we have to look at communities as a whole. That's what supports and develops individuals. And then also as nurses, which we are advocates, and we fight to promote people's health and to prevent health issues. And so that's our cornerstones, and the intervention wheels are what we're doing and how we are doing it. So how do you use the intervention wheel in public health nurse practice? So it's a conceptual model, right? Meaning it's this abstract idea. And so how do you actually implement it into physical practice change? So there's common language in there. We talk about prevention and screening and surveillance. It sets up a framework as how you're going to think and act as a public health nurse. So you know that you're going, if you're a public health nurse and you're working in the schools, what are you going to survey? Who are you going to collaborate with? What type of coalition are you going to form? Is there a nutrition problem? Let's form a coalition with the local farmers, vendors, people who have a stake in these outcomes. So the three components we talked about: population-based, 3 practice levels of individual, community, and system, and then the 17 interventions.